Hey there, kiddos. Welcome back. Here we are at chapter 20, Adult Biosocial Development. So, this is where most of us are now. So, hopefully, we'll be able to get through this rather quickly. All right. So, hopefully, and this will give us some insight as to who we are as grown-ups. As we get older, understand our physical health is going to decline and our bodies are going to become less strong. We're going to heal slower. Um, this is going to depend on not only genetic, but environment. Um, and it's going to, everybody's going to decline, but the rate of decline is going to vary between each individual, even within families. We don't all decline, even in families, the same way. Blood pressure is going to increase with age. So hypertension, the risk of hypertension can be heart attack. So we have to understand how to control the link between high raising of the blood pressure and and other diseases. So sometimes that rising blood pressure can cause, a multitude of other problems. So our breathing is also going to decrease with age. So if we don't if we smoke, if we don't eat right, if we don't exercise, if we have too much stress, then all of these are going to put even more stress on the lungs so that we're not able to, it's not just about the respiratory rate or the number of breaths you take, but it's also the amount of oxygen that your lungs are going to absorb, and that's going to be dependent on the health of your lungs. So that's why smoking and stress and eating and diet, things like that, are going to affect your oxygen intake in your lungs. Collagen is going to start to decrease starting at age 20. So our skin is going to start to show by the time we're 30. Skin's going to become thinner, less flexible. By age 40, age spots, blood vessels, and other imperfections appear. I really try not to pay too much attention to that because I'm like, I don't want to get old. But I was in a meeting yesterday with my martial arts instructor, and he said you have to understand that as we get older, things don't heal as quickly as we would appreciate. And I was like, I'm not going to talk about this right now. So, but it's getting older is something that, God willing, we're all going to get to experience. So our hair may turn gray. Mine actually turns silver. It's kind of funny. And, I used to pull them out because it was aggravating. But my husband's like, the more you pull out, for every one hair you pull out, two going to grow back. So, mine actually turned silver and is actually really shiny in the sunshine. Sometimes your hair can get thinner. Still waiting for that. But middle-age spread, when we're little, we go out and then up and then out and then up. Middle-age spread starts when we go out, but our body doesn't grow up anymore. So by the time we hit 50, there's going to be some noticeable changes in our physique. So those of you that are young, thin, and fit, enjoy it while you can, because once you hit 25, that's all she wrote. Your optimal health is between 20 and 25. So if you're between 20 and 25 and you don't like the way you look now because you don't think you have the optimal body, better get it now because this is as good as it gets. By the time we hit middle age, 50, 60, our height is actually going to start to decrease, and that's because our bones get more brittle. Osteoporosis can set in, so that's why calcium and vitamin D are important because it strengthens those bones. But of course, any type of your genes and any type of exercise or lack thereof, can affect the outcome of any of these. Your vision is going to change. Your peripheral vision is going to now narrow. So you're going to be able to see less and less of this. Eventually less and less of this, but more of this. Color vision, it's going to be harder to differentiate between shades, shades of color. So everything's going to be less bright, more dull. The adjustment between light and dark is going to take long. Nearsightedness increases. Nearsightedness meaning you can only see things here. Farsightedness means you can only see things out there. So your vision changes between farsightedness and nearsightedness is going to change. If you're farsighted, the lens of your eye is less elastic, and the cornea flattens out by middle age, and it actually also changes the shape of your eyeball. Young adults are usually either nearsighted or farsighted, but as we grow older, sometimes we actually do both, which is why we have bifocals, because we have one part of the lens helps us see up close, whereas the other part of the lens helps us see farther away. Which is which, I don't know. Thank goodness I'm not there quite yet. The sexual reproductive system, sexual arousal occurs more slowly with age, and the orgasm will actually take longer. You just don't have the hormones that you had when you were in your 20s. Any type of stress, is going to, if you get stressed out because it takes longer, that's going to, the distress at slower response is more associated with anxiety, interpersonal relationships, and expectations rather than aging. What that means is we're frustrated with ourselves because we don't act and react and respond as quickly as we did. So it's not so much about the aging that stresses us out. It's that we're not as quick to respond, and that quickness to respond doesn't always happen with aging. It can happen with other things too, stress, lack of exercise, whatever. There are so many things that can interfere with your sexual reproductive system. You can have sexual satisfaction at any age. Now that depends on the relationship you're in, the person you're with, what their expectations are versus what your expectations are. If your expectations are more along the same lines, then you're going to have a higher, there's going to be that higher rate of satisfaction versus, if one wants it more than the other and the other wants it less, then that interpersonal anxiety is going to mess with the reproductive system as well. Sex is more important than men than women. Historically, men have defined themselves by their virility. Women, again, goes back to what we talked about the last chapter about the chapter 19 versus actions versus emotions, because men communicate more so with action and women more so with emotion. That right there will that right there plays a huge role, because again, he sees the communication of intimacy physically, whereas she communicates that intimacy emotionally. Rates of pornography are going to vary by gender, culture, research methodology. Some people are okay with it and other people are violently against it. So depending on where you fall personally is going to depend on how people react to whether or not you view pornography. And of course, the range of sexuality and sexual satisfaction are going to vary between gender as well as individuals. Infertility, and the definition of infertility is the inability to conceive after trying to get pregnant for a year, although that definition is going to vary from nation to nation. The infertility definition of the year is here in the United States. What other countries define as infertility? There are, again, I can't speak for other countries, but at least in the United States, that's what it is here. And then of course, within the US, 12% of all couples are infertile. It could be because, and there's different reasons for infertility. The partly, if you postpone childbearing years, the older you get, the sometimes the harder it is to get pregnant. and then if you do get pregnant when you're older, there are health consequences. Your body just doesn't produce the hormones needed to maintain that pregnancy as well as it did when you were in your 20s and maybe even into your 30s. Of course, other issues for infertility could be, issues with her ovulating, issues with his sperm count, so there's different things. So here, so in males, um, age, fever. The thing with the guys is the warmer you keep your family jewels, the more difficult it is for you to be able to procreate, because that body heat will actually kill the amount of sperm in your system. Different type of toxins, drugs, alcohol, cigarette smoking, any of these can reduce the sperm amount, their shape, and even their ability to or the motility, which is their swimming ability. In females, fertility can be affected by anything that impacts anything: age, disease, smoking, dieting, obesity. There's I can't remember who it was now, but there was actually a movie years and years and years ago about, I want to say it was a senator out west somewhere, and his wife suffered from bulimia, and the story, the movie, I don't remember if it was specifically about her, but it incorporated a lot of about her, and with her fight with bulimia actually wound up causing issues with a pregnancy later on during their marriage. PID, pelvic inflammatory disease, can block the fallopian tubes, preventing sperm from getting to the ovum. If you've ever had an ectopic pregnancy where the pregnancy landed up in the fallopian tubes, that fallopian tube has been damaged and doesn't work. For whatever reason, if you've got issues with your ovulation, either you don't ovulate, some women only ovulate, some women don't ovulate every month, so one ovary can be more healthy than the other. So, 1 month, the ovary that's not healthy, but when that ovary releases that egg, then there could be issues. There's just multiple causes of reasons for infertility. But of course, with anything that we find fault with or anything that we're not happy with, the first thing we want to do is we want to fix it. So there are different type of fertility treatments. The first, what they call the assisted reproductive technology, can solve some medical problems. It can overcome low sperm count, blocked fallopian tubes. There is different methods out there depending on what the issue is. So any type of advance in reproductive technology helps with fertility treatments, whether it's using different types of hormonal drugs, whether it's shots, whether it's pills. There's a great movie, well, it's not a movie, it's a documentary. I think it's called One More Shot. I mean, it's this, it used to be on Netflix. I don't even know if it's still there anymore, but it was this couple's journey through infertility with their marriage and the different things that they went through to try to have a baby. One of those things was IVF, or in vitro fertilization, whereas it's ideally it's her eggs and his sperm, and then once the division starts to happen, then that zygote, or that itty bitty baby, is inserted into the woman's uterus. Most of the time when that happens, they will use multiple zygotes, because they're working with the law of averages. Between 25 and 50% maybe is what they're guessing, and then sometimes even that. So if they implant 4 zygotes, they're hoping maybe one will take. Doesn't always work, and sometimes all four of them take, so it really just depends on mom's health, dad's health, or mom's health, the health of the sperm, health of the egg, and then there's other contributing factors, stress and all that too, because stress can interfere with reproductivity or with reproduction horribly, because what it does is it imbalances all those hormones. Menopause, ladies, once we hit menopause, the average is 51. Happens earlier in some and later in others. But what happens is the menopause is just when the women's menstrual cycle completely stops. There's no progesterone, there's no estrogen, there's no testosterone, and it just completely drops. Now, there's different types of menopause. There's the natural menopause that women go through, and it can take years, it can take months. Some women go through it faster than others. There's also surgical menopause, where the ovaries are removed, or the ovaries and the uterus are removed, depending on what's going on. But once the ovaries are removed, if it's a surgical menopause, once the ovaries are removed, that's when everything shuts down. The uterus can be removed, if something happens when they call a partial hysterectomy, where the uterus can be removed, leaving the ovaries, so that the woman doesn't go into menopause. Now, chemical or hormonal menopause, she will no longer become pregnant, obviously, because she doesn't have the uterus, but the body is still making those hormones so that she doesn't deal with the effects of menopause, which is, once you go through menopause, most of the time it's harder to lose weight. The night sweats, just everything in the body changes. It affects, how long it lasts, and how quickly it happens will depend on your genes. And of course, psychological consequences are going to be there just as much as physical ones. So, obviously the lack of menstruation, and then the physical lack of being able to become pregnant, but it's also the psychological aspect of it, especially in women that want to have children but didn't have children because they didn't get married, or they didn't find the right partner, or whatever it was. There's that psychological, it's a mourning process for some, because those of us that have had children are realize that is something that we're never ever going to experience again. Some women are like, yay, I don't have to deal with it anymore. Missed out on having kids, and I'm okay with that. And once menopause hits, they're like, yay, this is it. But there are different psychological consequences, depending on the person, depending on, what their wishes and desires and dreams were, and how that combines with or conflicts with their reality. For some women, hormone replacement therapy is available. It's basically a treatment to compensate for hormone reduction, whether it's the estrogen, the progesterone, testosterone. Usually it's a combination of all three. But most of the time involves estrogen, progesterone. They will introduce testosterone if the sex drive is minimal to none. So there are testosterone supplements out there specifically for women, and specifically related to the estrogen, progesterone. It'll help the risk of osteoporosis decrease later on in life. And what osteoporosis is, it's just the brittleness of the bone, due to, again, hormones, diet, and genes and other things. But it can also increase rates of heart disease and risk of breast cancer. So if you have heart disease and breast cancer in your family, this is not something that you want. Regardless, it's not a decision that you want to make lightly. It's a decision that needs to be thought out, and well talked about between you and your partner, and your doctor. Men can also go through menopause. I call it andropause. Basically, it's that drop in testosterone resulting in the reduction in the either sexual desires, erection, or even the muscle mass of the male anatomy. for men, as far as, there are testosterone replacements, there's, I see commercials for it all the time. There are also, the little blue pill that men like to indulge in. Um, so there are so many things out there, even with women, the little blue pill for women, they're trying to work on, different avenues to help increase that sexual desire. Because I used to love, well, I love Lucy. And one of my most endearing, or to me, one of the most endearing episodes is when Lucy and Ethel are trying to hook up, excuse us, are trying to hook up the little old lady with the grocer down the street. And, the little old lady says, look, just because there's snow on the rooftop don't mean there ain't a fire in the furnace. So just because we're older doesn't mean that we want that sex drive to stop. It's just that, body chemistry being what body chemistry is, it just kind of happens. And then, but at least we have, for the most part, we have options to help with that. Sorry, this is, oh sweet, this is Lady Rascal. You a mess. Okay. Here we go. So health habits and exercise. Exercise is going to help at every age. It's going to exercise will help with help protect against serious illness. Sometimes it can protect against mental and physical health. Because what happens is that it helps to maintain a strong physical body, and maintains flexibility. So you're less likely to get hurt if you're more flexible. Just, like with anything else, a glass is going to break a lot easier than plastic will. Why? Because glass is not flexible, and plastic is flexible. So same with our bodies. If we're a little more flexible, then the probability of us breaking a bone is slightly less. So, and of course, the picture here is workers in an insurance company must sign up to use one of the 30 treadmill workstations so they can exercise as they work. Even here at home, we've got a treadmill downstairs, and we've got the treadmill. Well, the treadmill has to be plugged in, but we actually have an extension cord, because what happens is what has happened is we have a tablet right there on the treadmill, so that if we're watching television, or we're watching, we have Netflix or Disney Plus or Hulu or CBS All Access or whatever. We have access to all that on the treadmill, so that we don't use watching television as an excuse not to exercise. Does it work? Not so much. But it's there, and if I feel guilty for not using it, it's my own fault, not because the opportunity is not afforded to me. Drugs and coffee. Abuse of illegal drugs will usually decrease over adulthood. Most of up until now, or here recently anyway, the reduction in marijuana use. Now, of course, with the passing of legislature now allowing for medical marijuana, these numbers may actually change, because what's happening is it's marijuana, or the CBD anyway, is being used to help a multitude of physical ailments, emotional ailments, psychological ailments. Whether it's pain management for cancer patients, glaucoma patients use it. So I think these numbers are going to change. So it says past, which is what it says here, past data shows reduced, but of course with the new legal changes that that may change those statistics somewhat. And of course, coffee, it's not so much the coffee as it's the caffeine. But most people relate caffeine to coffee, maybe soda, maybe tea, but more so coffee. We may not find a Coke machine, you may not find a tea pitcher in every workplace, but 9 times out of 10, you're gonna find a coffee maker somewhere on campus, somewhere. And so how coffee affects an individual is going to vary between person to person because of genetics. Um, it's also a social thing. Coffee is a social thing. Growing up, I grew up in the South, and it was, is that afternoon coffee. After dinner, we would. My grandparents lived near a lake, and so we would all go on the porch after dinner with our, cup of coffee and sit and, during the summer, watch the boats, or in the wintertime, watch the birds or the ducks or whatever. It became a social thing. So it's not a dietary issue, or not a dietary habit, but it's a social habit. Um, as far as alcohol goes, drinking in moderation. Um, they say drinking, all things in moderation, right? So up to 2 drinks a day may increase life expectancy. Now studies are coming out. Red wine can lower blood pressure. It can reduce heart disease. It can increase the good cholesterol while reducing the bad cholesterol, and it can also lower the blood. Well, I just said it can lower the blood pressure. So all of these things point to some alcohol may be beneficial. Now, this is not an excuse for us to binge drink, and this is not an excuse for us to down the entire bottle of wine. Understanding that, a glass of wine is 8 ounces, or maybe it's 6 ounces. So 12 to 18, 8 and 8, 16, so 12 to 16 ounces of wine a day is, about what they're talking about. But too much of a good thing, like I tell my kids, too much of a good thing is still just too much. If you overuse alcohol, it can destroy your brain cells, cause liver damage. It can cause cancer, contributes to osteoporosis because it sucks the calcium out of your bones. It can decrease fertility because it's interfering with blood flow and things of that nature. Suicides, homicides, and accidents, because we lose our inhibitions, the lowering of those, inhibitions. And so we're less likely to police ourselves. And so it can, and if alcohol is out of hand, it can take a significant toll on families and communities. It has alcohol abuse rates are higher in men. They're higher in European Americans than African Americans, or even Hispanic Americans. And of course, alcohol abuse more so in the wealthy than the poor, and that's because of the price tag that is accompanied with the alcohol. The more money we have, usually that income is attributed to a lot of stress. And so, increased income is increased stress. Increased income will allow the purchase of more and more alcohol. So the more wealth we have, typically the more alcohol we have access to, and therefore may tend to abuse it a little more so than those of the more those communities of lower socioeconomic status. Our beloved Prince, or the artist formerly known as Prince. Opioid epidemic. Until the age of 25, most U.S. Data on adult use of drugs are positive. So, we are continuing to bombard ourselves with one drug after another. Abuse of prescribed medication. If we can't find it, we're going to get it somehow. I tried watching Breaking Bad, and the way it started off, I thought it was a comedy. And it was just, because you're talking about a man who's diagnosed with cancer now standing out in the middle of the desert by a camper, with no pants on, so I kept trying to find the funny in the whole thing. And it was just it was aggravating. And I got to, I think, the last season, and I was like, I can't take this anymore. So I Googled the end of it. And I'm like, I'm not watching the end of it. Because what that says is that there's more than one reason behind any type of epidemic like that. again, it goes back to the whole money thing too with alcohol. The more money we have, the better drugs we're going to get, the more pure they're going to be. Um, and it's if we can't make it, if we can't buy it, then we know what to say to our doctor to get it. But where prescription meds are concerned, we kind of have this thought process of, well, if it's a prescription, that means my doctor gave it to me, which means it's okay. So there was that unawareness that was associated with drugs. But what we saw with the OxyContin, epidemic, I guess, too, is that it's highly, 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 highly addictive. And anything that's highly addictive is difficult to come off of. Heroin, one of the most addictive drugs at one point was heroin. And so to come off heroin, they created methadone. Well, what we didn't understand was that methadone is also addictive. So you're trading one bad for another, and it's just which has fewer consequences. So any foreign chemical that you put in your body, we seriously have to think about, because there are the long-term effects. And the thing is, before we start use, we're like, okay, drugs are bad, drugs are bad, drugs are bad. And I'm going to do everything I can to avoid it. But if something happens, was it like Michael Jackson? He started on painkillers because during a Pepsi commercial, his hair caught on fire. And no doubt in the beginning, it was a lot of pain. But then what happened was that we've become psychologically addicted. And what that means is I'm going to stay on the medication because I'm afraid if I come off the medication, then the pain is going to be too much. And so then our bodies become physiologically dependent on this drug. And so it's like trying to bake a cake, taking the sugar out. It doesn't work anymore. You can't do it. So it's when you take a drug out of the system, the body goes into withdrawals, and it learns how it's going to have to learn, how to operate again with missing whatever it is it's missing. And that's how withdrawals happen, is the body just goes absolutely crazy trying to figure out how to deal without these drugs, and then try to purge the drugs from the system. Of course, as we get older, our diet is important. Our metabolism decreases. Digestion is less effective. And it's easy to overeat, or even maybe not necessarily overeat, but it's easy to gain weight when you're older, because we're not as active as we used to be, because our metabolism isn't as fast as we used to be. I can eat the same thing as my daughter, and my daughter may not gain weight. But, if I eat exactly what she eats, then, I'm going to balloon up. She can eat, a package of ramen every day, and it not affect her. But if I eat a package of ramen, it's going to affect me greatly. It's going to contribute to weight gain for me, and, maybe not so much for her. Genetics are going to influence our weight. If we have, Asian Americans tend to be a little shorter and a little thinner. African Americans tend to be a little taller, a little thinner. I have, the joke is at my house that I got my grandmother's genes on my mom's side. My dad's side of the family is tall and thin. My mom's side of the family, not so much. Got my mom's eyes and my grandma's genes, right? And so my grandma's genes help to contribute to, obesity. Obesity is not healthy, and is a huge mortality rate, because the excess body fat increases the risk of every other disease, including diabetes. It puts pressure on the lungs, because what happens is when you lay down, all of that weight falls right onto your chest, which makes it physically hard to breathe. Diabetes linked to eye, heart, foot problems, and even early death. If you have diabetes and you've got a sore on your foot, sometimes you don't feel it. It gets infected, it gets gangrene, so it has to come off. So, and it's, so there is just a multitude of problems that obesity can cause. And then, of course, not to mention the social stigma and the psychological impacts. Even though we are now trying to say, we are embracing a more fluffy environment, but we still find ourselves stopping to look at that, size 2 model and go, wow, I wish I could look like her. So it's that, um, because we don't want to be looked at as fat. People look at thin people and go, oh, she's pretty. People look at not so thin people or fat people and go, oh, you need to cut out a cheeseburger, or, it's one of the, I've seen people, make fun of people at buffets. I actually went to China with a friend of mine, and over the last summer, and she and I walking just down through the different villages, the looks that we got, we're like, oh my gosh, here's two overweight white women walking down through, the different villages of China. It was intimidating, because we're seen as something, you know, unattractive. And when you, even if you feel yourself to be attractive, but other people continue to tell you you're not or treat you as if you're not, that's where the psychological impacts come in, because you're like, well, no, maybe I'm not as amazing as I thought I was. In the US, we have an issue with what they call high calorie, low nutrient foods. That's the Twinkies and the ice cream and the carbs. Oh my gosh, right? So it's that high calorie, low nutrient food. It's got a lot of calories in it, but it doesn't have a whole lot of good stuff in it. We eat a lot of meat and we don't eat a lot of fiber. So weight gain is going to inevitably happen if we don't have that. We have to have a good balance of meat or protein, of fiber, of carbs, and too much of one thing and not enough of the other is going to throw that balance off, which is going to do something to the weight. Now, that doesn't take into account really, the different diets. Right now, the keto diet is a really big, and basically it's putting your body into a state of ketosis, which is cutting out, most, if not all, carbs, right? So, and what happens with carbs is the body will actually turn those carbs into sugar. And so that contributes to the consumption of sugar. We've got high fructose corn syrup, sucrose, which is sugar, that's are in our cereals, our beverages, our food. And then what happens is we get complacent and we eat these amazingly tasty, not so nutritious food items while we're sitting on the sofa waiting out this pandemic of COVID-19. And I think hopefully, having to be quarantined will help us to get out more so when it's over. And so, but I think the moral of the story as far as weight gain goes, be moderate in what you eat and what you drink. Be sensible in what you eat and drink. And remember, too much of a good thing is still too much. A little bit of carbs, a little bit of protein, just, a meat. When my kids are home, I try to do, or even now that it's just one kiddo at home, I still try to do a meat, a veggie, and a starch. Does it always work? No, because I don't like meat in my spaghetti sauce. So, don't like protein in my spaghetti. I like my spaghetti just the sauce and the noodles and nothing else. But, for my husband and my daughter, I'll throw in meatballs because that's what they like. So it's trying to find that happy medium, which is, easier said than done, of course. But, hey, if I didn't at least warn you, now I can say it's your fault, not mine, right? All right, so here we are. That's the end of chapter 20. This video, along with homework and PowerPoint presentations, are already up on Canvas. Again, if you have any comments, questions, or concerns, you know where I am. Feel free to reach out at any time. Until next time, though, you guys stay well, stay safe, and I look forward to next time. Talk at you later. Bye, guys.